Howdy Athens, I'm your city manager, Seth Sumner, with your daily COVID-19 update. It is Thursday, April 16th, 2020, and I want to start with the Tennessee Department of Health update to let you know where we stand today. And I'll start out with talking about McMahan County, of course, here locally. McMahan County, we have yesterday, and for a couple of days ahead of that, we had 5 COVID positive persons. 4 of those fully recovered. Today, we're showing a 6th. We have 1 new positive case in McMahan County now. So 2 people right now fighting COVID-19. Our best wishes to them. Hopefully they will fully recover as the other 4 McMahan Countyans have. And so our best wishes and hearts are out to you. So we do have 6 now. I want to show you on our state of Tennessee, still Shelby County and Davidson County leading the way as far as the number of cases. The number of cases now across Tennessee is 6,262. The number of deaths, 141, which is a slight increase from yesterday. So what we were so afraid of just 2 days ago when we saw this spike of 14% increase, the largest daily increase of deaths in the state of Tennessee that we've seen throughout this entire pandemic occurred just 2 days ago, and we were praying that that does not create a new trend. And so far, thankfully, it has not. We have reporting much fewer deaths now. That has slowed, and so hopefully this will be the worst day that we see. Let us all hope for that. Let's keep this trend of minimal positive cases and certainly minimal deaths moving forward, which means that hopefully we're seeing now the backside of the surge. Today, April 16th, was when you looked at the healthdata.org information that's put out through the University of Washington. I've shared with you a couple of times. It has today as the peak surge during this week. Today should be the peak surge, and we're actually showing a decline already. So it looks like our surge may have actually taken place a couple of days ago. Let's hope that's the case, and that our numbers don't jump up from here. We do have to be aware, though, that they may. We are testing more and more now than they were before. Of course, there was few tests available, although they were available for sick people early on. Now we're doing mass testing where many folks, even without symptoms, can get the test because we have lots of tests on hand. They're available. They're ready for you. You can go tomorrow and get those tests through a drive-through testing center at the McMahan County Health Department. No charge. You don't have to even be a resident of McMahan County. You don't have to have insurance. Everybody that wants to get that test can get that test performed at the health center. We will also be following up with a massive test center where we'll have actually 4 lanes set up at the Lehman Exposition Center. It's on the backside of Regional Park. You have to drive into and through Regional Park to get to that, and that is Sunday, noon to 3. And so we'll be able to test many people on Sunday, noon to 3. And you'll be hearing more from County Mayor Gentry and myself on that coming up. You've seen, hopefully in the press, you've seen some of that information being released now. And so if you want to be tested, here's your opportunity. Tomorrow at the Health Department or Sunday at Regional Park. So, and I'll remind you of that towards the end. But to get back into our Department of Health data, so we are seeing the flattening of the curve here, and hopefully this stays true, and we will actually have already reached our peak, and now we're on the back side of this. That is our hope. We do now have someone as old as as mature as 100 years that has COVID-19. We have 691 Tennesseans that have been hospitalized, which shows that 82% of our population that have tested positive have not needed hospitalization. We're thankful that we do have enough resources across the state of Tennessee and locally to handle that capacity, even if we do see another spike. We do have the hospital beds, we have the ICU beds, and we have the ventilators to take care of our vulnerable population that have contracted COVID-19. This is a wonderful number. 44% of cases across Tennessee have fully recovered. That's 2,786 people. We're very thankful for those folks. We are showing 2% of all positive cases are now deceased. 141 Tennesseans have lost their life due to COVID-19. However, that does mean that 98% of the population is surviving and recovering from it, and we're blessed for that. We don't want anyone to lose their life during this, and certainly for the folks that have been affected, you've got our best wishes. We're here to support you. We love you and we want a full recovery, but this is the grim matter of a pandemic of what we're dealing with day in and day out right now. And we've got to remind ourselves that this could be the case. If we don't socially distance, if we're not doing our part by staying apart, these numbers could spike. These can increase. So we've got to be cautious. And I know Athenians and McMahan Countyans are doing their part because our numbers remain low. I did talk to our local health department just this morning, and yesterday, out of 102 tests that were performed across our 10-county region, 41 of those tests were in McMahan County. We're testing at a higher rate than anybody else in our region, and we're also showing, other than Ray County, the lowest incident rate of positive results. And so that is tremendous. We're testing more and we have a lower infection rate. So we're able to prove that because of the testing. And so that's what the governor's wanting to do. That's what the health departments are working on right now. Is making sure that we get those tests out and available to the public to make sure that everybody that wants to be tested, that needs to be tested, has that opportunity right now. Let's see if I can get this thing to scroll again. And so you see the number of tests just skyrocketing in the last few days. We're now over 85,000 tests have been conducted in Tennessee. We really are we're deeply appreciative for our health department, for our emergency management folks, everybody that's playing a part, our healthcare workers that are making sure that we're ramping up and we're getting more and more and more tests every day and making sure that our population can be tested. Because there are the cases where folks may not have any symptoms and may be carrying it. And if they're carrying it, they may be able to pass it on to other people. And so we need to know if they're positive so we can quarantine you, let you recover, and so make sure that that doesn't spread. Our fear early on, and why you saw much, much greater projections in this data, was that what the early projections were showing was for every one person infected, they were likely to infect 5 other people. That means that we would have doubled in our infection rate every 4 days, and that would really drain our resources. That would mean more sick people, that would mean more deaths. What we're finding out now is that for every one COVID positive person, it's only being transmitted 1.5 times. And so our numbers, our projections are looking much, much more favorable now. So just to show you McMahan County, as I mentioned a moment ago, 4 fully recovered, now 6 positive cases, and of course as we're testing more, do expect this number to increase. We're going to find out folks that may be asymptomatic that test positive. So we need to catch that. We need to catch that. But that's out of now 364 tests here in McMahan County alone. So great job, Athens. Great job, McMahan County, for really leading the southeast region of Tennessee in testing and doing our part by staying apart. And so that's what our data is showing from the Tennessee Department of Health. And I do have a guest, if you'll join me from a socially responsible distance. I have Miss Frances Witt McMahan, who is the Executive Director of CASA Corridor, court advocates for what we've been talking about this week are our vulnerable population, who's taking care of those folks, how can we all do a part and help take care of those folks. And so we talked about United Way on Tuesday. We talked about our senior population yesterday, and today we talk about the other end of the age spectrum. We're talking about children. Children, and obviously it's April. We've talked about Child Abuse Prevention Month.
That's right.
So we're aware that families, parents, folks are in the house, and that's a good thing when we're in a good family unit with healthy relationships and healthy mental faculties and emotional faculties, but that's not the case for many in our community, and that's where you step in.
Yes.
That's where you step in to take care of that vulnerable population, those children who can't help the home that they're raised in, can't help the environment that they live in, and sometimes some very hard decisions have to be made, and the courts step in and are always seeking for the best interest of those children, the most precious resource that we have.
That's it.
So thank you for being with me today, Frances. It's good to see you out and about, and would love to, for folks that may not be familiar with CASA Corridor, what your mission is, what you do. Tell us a little bit about CASA.
Well, first of all, I want to thank you for letting me be here today. This is actually the first time that I've been out in a while, and so I'm enjoying getting to actually see you live. But CASA Corridor is a synonym or acronym for Court Appointed Special Advocates for Children. And what we do is recruit citizen volunteers, people just like ourselves, who would complete 30 hours of training so that they would know how to go into the courts and work with families who are having issues with abuse and neglect of their children. We train these advocates to make unbiased recommendations to our judge. In McMahan County, we see Judge Wiley Richardson and James Watson as the magistrate. And so what we do is make sure that those advocates can go in and work with the family and the children primarily to see that the children are placed in the most efficient home that would raise them and give them stability and nurture and love. Our advocates are screened very carefully and do the training and meet all the requirements before we actually would appoint them to a case.
I imagine that's substantial training and screening just to make sure that you're getting the right fit of person that can, because that's got to be hard on an individual to be walking into a tough family situation, and they don't know you.
Right.
You're not family. You're going in and you're trying not to be judgmental or anything of that nature, but just look out for the best interest of the child in that family unit, and make recommendations to the court system on if any actions need to be taken in the best interest of the child.
Well, and typically the advocate is, they just care about children. Most advocates have been teachers or mothers themselves, fathers, and they've been in situations where they don't preconceive anything about a family, but they have discernment, and they know how to talk to the child. They're taught how to do the interviews, so that they're not asking leading questions, but questions that would let that child open up and feel comfortable speaking to them. Many of our children and youth say that their advocate is the only person they trust. And so they're talking to them and they're telling them what's going on in the home so that they can get into a better situation.
So these are children. What age range are we talking about typically that you're servicing?
We serve birth to 18 years old. And what we do for children, like babies and infants who can't speak, part of our training gives them all the information they need to understand the milestones that a child should be meeting, so that when they are in a home and that child is not thriving, that may pose some questions. And so then they know what questions to ask the parent or to ask other family members or neighbors, what might be going on in that home, so that they can make that clear to the judge.
Very good. What other agencies are there that perform this type of work that we would need to know about?
That is great. Well, CASA is the only organization that is appointed by the judge. However, we work with so many agencies, the Department of Children's Services, who is a state agency.
Yes.
And then we work with Child Abuse Prevent America. And then we also work closely with our local 10th Judicial Child Advocacy Centers. And they work primarily with severe abuse cases and sex abuse cases. But we all, in our local area, work together to make sure that the best interests of children are served. And I think we do a really good job meeting those needs.
All right, so I've noticed, and I've wore one before, a blue ribbon. Tell us about the blue ribbon. What does that mean when we see
it? The blue ribbon, and we like to see it. I have a blue shirt on today. I didn't have a blue ribbon, but it symbolizes prevent child abuse. And so we want to get the message out that this is the month that we really focus. And although we want people always to take care of children and to make sure that they have successful outcomes, but this is the month that we work our hardest to bring awareness to people who are outside of our local organizations.
And I saw you walk in today. You had a pinwheel.
Yes.
What is the pinwheel?
And so what you may notice these pinwheels around the county, and you'll definitely notice them if you go by the house on Madison Avenue. It's the Child Advocacy Center's house, but that symbolizes the number of children in our area who have been abused. And so there's a pinwheel for each child. And we typically try to plant pinwheel gardens at our office or maybe at the courthouse. Because of the COVID-19 pandemic, we have not done that this year. But I did bring a pinwheel today just to let people know that if they see those, just stop and just, say a prayer for a child that may have been abused.
And so each pinwheel we see represents a child in an abusive situation.
That's the goal.
I don't want to see any pinwheels.
I know. I know.
So we talked about in really bad situations, children being removed from their family. What's the biggest reason that you see that happens?
Right now, about 1/3 of the children that we are serving are being removed because of substance abuse. Meigs, and Ray County have a high rate of opioid addictions. And in fact, I was doing a grant the other day, and one of our counties has about, per 100 persons, prescriptions written, there's about 105% that has some abuse going on. And so that's pretty high. Tennessee is high on the list for opioid crisis.
So obviously affecting more than just than workplace, than individual lives, but infiltrating families and causing some real harm and damage to our children
Definitely.
as well.
Yes.
Wow.
And some of these children are born addicted to drugs themselves because mother may have been using while she was carrying that child.
So you have folks that help you, volunteers, you've got staff. We talked about advocates. Now, tell me about a mandated reporter. What is that?
In Tennessee, everyone is a mandated reporter. If you suspect child abuse, you should make a phone call, and I can give that number. I would like to give the phone number.
Yeah,
877-237-0004.
One more time. So
877-237-0004. If you suspect child abuse, then you should call that number. CASA is not as much about prevention as it is to take care of the child once they've been abused. But if we have more people making phone calls and not feeling like they're being nosy or that it's not their place, then we could stop child abuse and I could be worked out of a job. And then I'd come to apply and work for you maybe.
yes. I would love to see that you're out of a job because there's no more child abuse.
I would love that too.
That would be a beautiful world. I really appreciate that approach. Legally, I mean, it's so I'm a mandated reporter.
Yes,
You're
you
a
are.
mandated reporter. All of you are mandated reporters.
Everyone.
That's the community approach that we talk about here in the Friendly City, that it's it's every citizen's responsibility to participate, be engaged, and to be helpful,
Right.
to be a part of the solution, not just calling with a complaint. We'll take those too.
Yes.
We want to know when things aren't going right, but we all have a responsibility, every single one of us, living in this wonderful community, to be part of it and to be engaged.
Exactly.
And when we see something not going the way that it needs to be going, especially in this case, child abuse, it's our responsibility. We have to. We have to call.
Yes.
So you've got that free number. If you see it, say something. So how, you mentioned the number. Are there other ways that people report suspected abuse? What's the best way for folks to do that?
Well, often I get calls from people locally, and they don't know who else to turn to, and so I will usually direct them to the Department of Children's Services, the local office, this number as well, but there have been times that I've reported myself for people because they didn't know how to go about it, or I knew that they weren't actually going to make the report. Oftentimes it's a family member who suspects another family member.
Sure.
So they don't want to cause friction in the home or in, their relationships, but they may call our office and say, I think this is going on, but, I don't know what to do. And so I'll take as much information as I can and make that report myself and make that call.
What am I looking for? I'm mandated to report it. I'm seeing something.
Okay.
But is that child abuse? Is it not? What are those signs?
If you've been around a child, and teachers usually are the best reporters because they may have a student who is doing so well and they're upbeat and come to school ready and prepared, and then suddenly this child starts coming to school and they're not interested in learning. Their attitude changes, and so typically that teacher would probably call the child aside and maybe take them to the school counselor, and they'll start some interviews with the child. Usually child abuse is found that way, but then there's also if you see a child that always has some type of bruising or different marks on them, and a lot of times you may have a parent to say, oh, they're clumsy, they fall, or the child seems very afraid of their parent, not to the degree that they're respectful to the parent, but there's a real fear. And so when you see those things, it's kind of good to to pay attention. It's not always the best thing to jump the gun and, you know, make an accusation right away, but if you continue to see something like that, it's best to question it.
Absolutely. How many children are you interacting with on an annual basis here?
In our program, CASA Quarter, we typically serve well over 250 children a year. There have been years that we've gone as high as 300, but 250 is about an average. But there's so many more cases that are reported. I would say in McMahan County, about 870 cases were reported in 2018. Meigs and Ray are a little bit less. However, in Ray County, more cases are substantiated than in our county. I think we do a really good job, and that's not to say they don't, but we do a really good job in McMahan because we have so many agencies working together on behalf of the children.
Good. When it does happen, we have the folks that
Yes.
are there to take care of it, step in and seek action on behalf
Yes.
of the child. Wonderful. What about nationally? We look at locally, that's some good numbers to know, but nationally, what's the effect?
Nationally, there's about 133,000, a little bit over that, cases of abuse, and then there's about every 15 seconds there's a call made to report child abuse. So there's a lot of children who are in bad situations, and if I could add something. Right now, we're expecting a big influx of cases once this whole pandemic ends. Our courts are closed. They are meeting for emergency cases right now, but there are children who are in homes that have pending cases, but because the courts are closed, they can't get into the court. And so we're concerned about those children. What is going on in those homes where those children there was already a report of abuse, and now there's no one that can actually go into the home and check on them, because our CASA advocates go to the home and they go inside and they look in the cupboards to make sure there's food to feed those children and make sure that, you know, the parents don't have drugs all over the place. We are officials of the court once they're sworn in, and they have all the rights and privileges of anyone else who would be in the court. And so not being able to do that and having to work with the children virtually is really concerning to me. So we expect to have a big caseload once we're able to get back into the homes.
I'm sorry to hear that, and I know that as soon as we're through this, that'll be the case for many of our issues right now. Really appreciate everything that you do to take care of that very vulnerable population, those children who are being abused, and I think usually in those really bad cases, actually getting the child removed, making sure that they're put into a better, more stable environment so that they can recover and succeed in life. And for the lesser cases of actually getting the resources and helping improve the conditions within the home. I know we hear from the court system, we hear from judges. You know, the last thing that folks typically want to do is remove a child from a family situation. So those have to be really bad circumstances to warrant that. Well, it breaks my heart to think about that. It really does, but I'm happy to have somebody like you and the advocates and your staff and our court system out there looking out for the children in our community.
We continue to do whatever we can. If anyone is interested in becoming an advocate, we are still doing training virtually, and I would love to speak to you. Our website is www.casaquarter.org. You can reach out to us there, and we would love to speak with you if you would like to help a child in McMahan County.
I hope some of y'all are being called to do that right now, and so please do visit CASAcorridor.org, and you can go and find out how to become actively involved in changing a young person's life. So thank you for that.
Thank you. Thank you for letting me.
Is there any special message you would like to share with our community?
Not at this time. I can't think of anything except I'm just glad to be out of the house.
Good. Well, good to be with you, Francis.
Thank you so much.
I do have a few other announcements before we close today. Just a reminder that Governor Lee has extended the stay-at-home order until April 30th and is working with certain folks in state government. Commissioner of Tourism, Mark Ezell, is going to be leading a team that is going to be developing a plan to help restart our economy, make sure that our folks that are out of work right now are going to be able to get back to work in May. We're hoping to see that. Hopefully, if our data continues to trend downward as it is the last couple of days, we're very thankful for that. That's because you're doing your part. Thank you, Athens. That stay-at-home order to the 30th, also part of the order is those non-essential businesses are to remain closed until that period of time. And I know that makes a hardship on some of our small businesses. And there are some resources that we talked about last week that are available through the state of Tennessee to help you through these hard times. So call on our state departments that can help you and see you through with helping with payroll, helping with there have been an opportunity for federal grants to help see you through this hard time, and I hope you take advantage of that if you need to. There will be, as I talked about earlier, testing tomorrow, 9 a.m. to noon at the McMahan County Health Department. Go there. It's a drive-through test. They'll do that in about 5 minutes, and then you'll be on your way. And then Sunday we'll have a really big drive-through testing site established at the Exposition Center that you'll come into Regional Park and you'll be directed and get you back to the Exposition Center. You'll drive through, same thing. We'll have a National Guard there helping with that testing and making sure that you get what you need in about 5 minutes, and out you go, and they'll take those tests and get your results in a few days. So there'll be a big mass testing at that period, and that is Sunday, noon to 3 at the Exposition Center in Regional Park. I wanted to follow up on an announcement from earlier. We knew that Governor Lee was going to make an announcement yesterday in regard to school closing, whether it would be open back up, stay closed. He made a recommendation that schools close for the remainder of the year, and I have heard now from Athens City Schools and McMahan County Schools are following the governor's recommendation to remain closed for the remainder of the year. And so those schools, they'll be communicating with you. If you have children in those school systems, they're communicating with you. They've already initiated that. You should be getting the text messages. If you get emails from them, you'll get those. But you'll get that information from the schools to let you know how this affects you and your children and what you need to be thinking about, and how we can get through the next few weeks of this together and see our community through this pandemic. It's really nice to think that we may be seeing the downward slope. We might be on the back end of that peak and that surge, and we're testing more and more, and hopefully those are all going to be negative.
Hopefully.
And I think it's just a blessing that McMahan County's only had during this entire pandemic 6 positive tests now through today, and 4 of those fully recovered already. So all because of what you're doing out there. Our Athenians and McMahan Countyans are doing their part, staying apart, staying at home, only going to the grocery store, going to those essential businesses, doing your shopping with our local businesses by text message or through their website, using those ways of still conducting the business that we need to do, supporting our small local businesses. That's very important right now, that they have some revenue stream and that you're able to get the things that you need, and even though we can't do that in person right now. So order takeout, call that shop owner that's got, we got birthdays, we got celebrations coming up, that you reach out to them and get the gifts that are going to make put a smile on your loved ones' faces. And that's what it's about. We're in this together, and we're going to see it through. And I'm proud to be with you. May God bless you, and may God bless Athens.